This video demonstrates just basics of logging in and navigating in Greenway's Prime Suite. You should be given a password and a login. It can be used to log into Prime Suite. I'm going to discuss some of the general navigation options, but obviously there will be videos with greater detail for individual aspects of the program. The first thing I would like to draw your attention to is when you are logged in, your name and login will appear in the top right-hand corner. Please use this logout to leave the program every time you're finished with Prime Suite. Refrain from clicking on the X at the top of the screen, as this may leave your login session open on the server and could slow down performance for other users. So again, click not on the X to log out, but on your login name at the top right-hand corner of the screen. This is referred to as your desktop and can be returned to anytime you click on the Greenway sign in the top left. So regardless where you are in the program, you can return to your desktop settings by clicking the Greenway sign. For providers, the AR Management tab is not going to have any value. Moving to the right, the Chart tab, two areas you'll be interested in are Patient Chart and Orders Tracking. There are also some settings under User Settings Admin which may be adjusted from time to time. Schedule, there will be a brief tutorial provided for utilizing appointment scheduling, but generally your day's schedule is demonstrated on the desktop. The Help menu can be helpful, using Prime Suite Help to run a search for issues you might need extra help on, but common processes can probably more easily be managed by asking your medical assistant or someone on staff who has done what you want to do before. Moving further to the right is an icon that addresses medication renewals, which are handled by the medical assistants. You will live heavily in the task menu to adjust tasks associated with patients. There are many tips and pitfalls for using task management, and that will be covered in a separate video. The next icon over is document import, and this has limited utility for providers at point of care. The next menu over is Greenway Mail, or what they call the Messaging Center, and this is messaging within the office that does not stay within the patient's chart. So issues about bowling on Monday or staff changes are generally addressed through the Messaging Center. You can compose a message to anyone on staff, much like an email, but you can also reference patients in the record to be more specific, but again, this does not store in the patient chart unless designated. So generally these communications are good for problems, concerns, or coordinating staff events. The next menu over is a list of links, and you can store your own web links for quick resources. So in my list, I have a quick link to the FRAX calculator to adjust or calculate a person's risk for fracture and address their need for management of osteoporosis. So quick links for clinical resources can be adjusted here, but they can also be managed in your browser as you prefer. The desktop then has quick access to orders, which generally gives me access to orders that have returned results, unsigned documents, and then a list of patients for the day. You can click on any single patient to take you directly to that patient's chart, and it takes you to what is known as their face sheet. You can navigate back to your desktop as mentioned by clicking on the Greenway sign. When in a patient's chart, you can also navigate from patient chart to patient chart using this drop-down icon in the top right, giving you a list of patients recently visited. This order will be listed in the order you have accessed those records. So this is a very valuable tool. When in one patient's chart, you will also see recent charts listed across the bottom as tabs to again go from one chart to the next. And you can always return to your desktop by clicking the Greenway sign. We often refer to the left-hand column that is darker as the dark side. So if you hear that referenced in teaching or instruction, we're referring to the left-hand column. From the desktop, you can search for specific patients by clicking on the icon at the top left, which gives you a search dialog. You can type their name if desired, but you can also search by any of the other criteria. So if one is called in the evening on a patient, but all you have is a phone number, one can also search by phone number to find a list of patients that may be listed under their phone number. So searching for patients can be handled by the icon to the left. When in a patient's chart and navigating back to the desktop, that last patient is left in the buffer and their name is listed to the top right. You can still view information about that patient by clicking on the I at the top left, giving their age, date of birth, and some contact information. The remaining icons to the right of the patient information button do not provide significant information for providers at point of care. So your desktop is going to be where you spend much of your time and navigation during the daytime as you are seeing patients. Patients who are checked in will have their name highlighted in a gold or yellow color. Please remember when logging out to click on your ID at the top right.